Neda, what is the maximum that you've gone with the range of correction post-operatively?
So the most I've done is that patient who I shared who I did the Yamani in, and she was, I think, -2, -150. So you can do on label ±2 of sphere, and two diopters or 3 diopters of SIL, but you can, practically speaking, sometimes get more than that.
Push more than that. Okay. And can you
Love
give
the Yamani patient. We've been looking for a patient like that for a while, but that's great. What a great news.
More on what happened. What was that case like in pre-op and post-op? How did it work out? And
yeah.
How are the haptics also, if you can tell us, how are the haptics in comparison to the Zeiss? And how do they behave the same way, or do they behave more like the other lenses?
So it was challenging to Yamani this lens. I don't know that I would necessarily plan to do it, but in a pinch, it works, obviously. I felt like the haptics were a little bit brittle, and in fact, actually the first haptic broke off, and so I had to explant the IOL and put in a second IOL to actually get it Yamani'd. So this patient had a really subluxed lens with basically inadequate capsular support for in the bag fixation for that lens, and no zonules in an entire area, and the capsule was just really friable. So I've done, Kathleen McCabe has shown this beautiful technique where you basically scleral fixate Ahmed segments. And so I've done that for a Marfan's patient before, and that was actually my intended plan for this patient for this eye, but the capsule just couldn't even support an Ahmed segment because it was just so friable. And so then I knew that this is what she really wanted, and she really wanted to be spectacle independent. And so plan C was to put in a Yamani, and it worked really beautifully. It took a long time to get there because obviously from explanting an IOL, I had some sutures in the cornea that had to be removed and took a while to heal, but she was so patient and is so happy. And so she's really a testament to what you can do with this technology. And people are willing to wait for their best vision because they know this is going to be their vision for the rest of their life. And it's just a few more weeks in glasses.